1 in 1,333 of the population in England has experienced anaphylaxis at some point in their lives. Those are alarming figures. Now, we tend to think when you talk about allergic reactions, we all tend to think about peanuts, don't we? That's the only thing that we think about. But there are lots more. I'm just putting all my facts and figures there. Lots more. Allergy is the most common chronic disease in Europe, for instance. Up to 20% of patients with allergies struggle daily with the fear of a possible attack, anaphylactic shock, or even death from allergic reaction. That's globally. The World Allergy Organization estimate out of allergy prevalence of the whole population by country ranges between 10 and 40%. So it's something that I don't think is highlighted enough. Joining me now, I want to look at this story from all different sides. Professor Adam Fox is a pediatric allergy specialist. He's going to join us first. Then we're going to talk to somebody who actually has been in, a very dangerous situation, and somebody who's created something to alleviate that. I'll explain further as we go along. Professor Adam Fox joins me first, though. Adam, thank you so much for your time. Whenever we read or hear about allergies, we just usually hear rather, I think, sensationalist stories about peanut allergies, but it goes a lot further than that. Just tell me what sort of chronic allergies that children can have.
So there's a whole range of different allergic diseases that exist, and in fact the most common will be respiratory allergies. So hay fever, for example, is a good example of a allergic disorder. It affects around 20 to 25% of adults in the UK. And for most of them, it's a minor irritation for a few weeks, and that's it, and maybe some over-the-counter antihistamines, and they're fine. But for a small number of those sufferers, it's really troublesome and has a major impact on their quality of life. But then there's other allergic diseases, so things like eczema, asthma. The one that probably most people think of when they just hear of allergies is food allergy, which has become a major public health issue in the UK.
Really? Because, again, it's not just, when you say food allergy, it's not just peanuts. What sort of other foods cause the most sort of chronic allergies?
Well, people are always really surprised to hear that the most common cause of severe allergic reactions in younger children particularly is milk. An egg allergy is far more common than allergy to peanuts. But I think, just for historical reasons, this has sort of just become attached to peanuts, but you can be allergic to tree nuts, so things like hazelnuts and walnuts and cashews. You can be allergic to fish and shellfish. You can be allergic to milk, egg, wheat, soy. There's a whole range of things, although most food allergies are accounted for by about 9 or 10 different foods.
Now, when you say eggs, or something like eggs, is it like nut allergies? Is it anything with eggs in it, or is it just an egg?
Well, there are some differences between food allergies. Egg allergy is a good example of what tends to be more commonly a milder food allergy that's usually outgrown by younger children. And most of those kids will only react to egg in the plain form. So they'll react if they ate a scrambled egg or some fresh mayonnaise with raw egg, but they'd be okay with cakes and biscuits and things that have got baked egg in. But most kids outgrow that, whereas allergies to milk, often you can be allergic to milk in any form, in the same way that you'll be allergic to peanuts or tree nuts, whatever form they're in.
No, I'm allergic. I mean, a lot of people of colour have an intolerance, and I guess that's something you can explain to me, the difference between an intolerance and an allergy.
Yeah, that's a really important difference. So allergy is where your immune system is involved, whereas an intolerance is when your immune system isn't involved. So intolerances aren't dangerous, but they can be really unpleasant. And the most common intolerance is lactose intolerance. And it's really common, not just amongst people of colour, actually. Globally, most of the world's population are lactose intolerant. In fact, nearly all mammals are, but there's a little bit of an exception amongst Northern European Caucasian humans that they're able to tolerate lactose in adulthood, which is something that barely any other species can. So very much the norm is to be lactose intolerant. You outgrow the ability to tolerate the sugar in what would be your mother's milk, so that you can't eat other species' milk, which of course, when you think about it, is a strange thing to be doing. Whereas just some people have adapted and they are able to tolerate cow's milk in adulthood. But for most people can't.
Wow, fascinating. fascinating. Absolutely fascinating. Okay, so here's the $100 million question. Why do some people, some children, have these allergies? I mean, where do they come from? You read so many things. It's because the world is a cleaner place, so they might not be exposed to X, Y, and Z, which goes on to cause an allergy. This, that, and the other. What creates it? Is it genetic? Is it hereditary? Is it lifestyle? Or all three things plus more?
Like lots of complicated things. It's pretty complex where this comes from, but our understanding has moved on tremendously. And we now have a pretty clear understanding that the way that we become allergic as infants, so we're not born with food allergies, but infants, particularly infants who have got eczema, are at high risk of becoming allergic to foods. And one of the key reasons we're seeing a lot more food allergy is that we're seeing a lot more eczema in infants. And if you're an infant who has eczema and you're in an environment where other people in your family are eating, for example, peanut butter and then kissing and touching the baby, then the risk is that the immune system in your skin, which is exposed because your skin barrier isn't doing its job properly because you've got eczema, so your skin's all inflamed and angry, that the immune system in your skin gets to see the peanut protein that's then left on your skin, and it doesn't know what it is, because if you're an infant, you've never eaten peanut yet. So your gut immune system has never seen it. So it doesn't know that it's food. And there is a risk that your skin immune system makes a mistake and erroneously develops an allergic reaction or an immune response to it. So that when you then go on to eat it, you get a nasty surprise and a reaction. So it's all about where in your immune system and when in your immune system that exposure happens. And that's why we now understand that early exposure and introducing allergens early into the infant weaning diet can be a really effective way of preventing the development of food allergies in the first place.
Wow. I'm talking with Professor Adam Fox, who's a pediatric allergy specialist. One of the reasons, many reasons I'm so happy to speak to you, it's because there aren't many people in your field, are there?
So unusually in the UK, compared to other developed healthcare economies, there's very few allergy specialists. So, for example, I'm one of probably about 40 pediatric allergists in the UK.
Gosh.
And that compares not very favorably to France, Germany, Spain, where there'd be something in the order of 1,500 to 2,000 specialists doing broadly what we do. And unfortunately, in adult medicine, it's a pretty similar picture. And there's historical reasons for it, and things have improved in the last few years, but we've got a long way to go to catch up. There's probably more allergists in an average American city than there are in the whole of the UK.
Blimey. And now, just before we come to my next guest, the question is, or the issue is that allergies, in some cases, can kill, can't they?
They can. And we're always keen to point out to our patients that thankfully fatal anaphylaxis is rare, and it does seem to be decreasing over time. Although the number of episodes of anaphylaxis has been markedly increasing over the last 20 years. And if you look at NHS figures of the number of people showing up in A&E departments with severe allergic reactions, it's really skyrocketed over the last few years. And if you dig into where that increase is coming from, it's children with food allergies that's driving this. So we are seeing more of these allergic reactions, not necessarily that there's more people with allergy. That seems to have been reasonably stable over the last few years, but there's more severe reactions presenting to hospitals. Now, the data suggests we're probably getting better at dealing with it. There's more adrenaline injectors around. You're more likely to be carrying those in the community. And, what we really hope for is that in the places where you're most likely to have a bad allergic reaction, those adrenaline injectors might actually be there waiting for you, which would be fantastic. And of course, is the reason we're chatting today. But we've got a long way to go around patient awareness.
Sorry, Adam, you said places where you might be most likely to have a reaction. Places like, well, I guess if we're talking about children, schools is at the top of the list.
Schools and school canteens, yeah. I mean, if there's large numbers of children, and in truth now, because of how prevalent food allergy is, there's not many classrooms in the UK where there won't be at least one person with a food allergy. It's not hard to predict where those kids in school are most likely to have reactions. It's probably in the canteens and where they're eating. So if we're able to anticipate these things, I think it makes a really big difference to the families and to the patients who are suffering from food allergies, knowing that somebody else has got their back as well. And it's not just them having to worry about these issues themselves.
Absolutely. And we've talked about the stresses and strains and worries post-COVID of kids going back to school. This is one of many. If you don't feel that you are looked after or you're going to be safe, you're going to be doubly stressed. Stay with us, because I want to talk now with Zach Marks, who's done something about that to help kids with allergies in schools or anywhere else, and Ava Illingworth, who was on the receiving end of one of Zach's inventions. Zach, what made you decide to, well, first of all, you should tell us what it is you've created, Zach, and number two, what made you design it?
Yeah, so I have lived with a severe nut allergy for most of my life, to be honest. I originally found out about my nut allergy because I had a trace of peanut butter on a piece of toast that my friend had, and that made me ill for a couple of days. Thankfully, I didn't need an adrenaline pen, but I got an allergy test and found out I was allergic to all tree nuts, peanuts, legumes, and have been made to, carry my adrenaline pens with me wherever I go after that. But unfortunately, they're very easy to forget and they expire, everywhere between 7 and 12 months. So I think there's been studies out recently that about half of all allergy sufferers, or 40%, don't carry their adrenaline pens on them.
So what did you... And how did you come up with, you better explain to our listeners and our viewers what it is that you came up with that has proved life-saving in at least one case.
Yeah, absolutely. So I designed with my team and first at university these kits, which they're called Anaphylaxis Kits. It was my university project back in 2020, and essentially they're made to be, you can actually see one on the wall behind me, just like a defibrillator, but for allergies. So the idea is they're wall mounted in the school, like in the cafeteria or the front reception, as Adam said, where these things can happen. And inside you have the adrenaline pens. So we provide multiple keys with all these kits. And all you need to do in an emergency, if you don't have your own adrenaline pens, or if you've developed allergy for the first time, then you go to a staff member or wherever a key is, push it in, turn to the left, unlock it, and that comes with you to the emergency. Then inside, really clearly laid out, is 4 adrenaline pens. So these are spare and they can be used if you want to treat allergy in both doses with treatment instructions right here.
So now we've just described what it is, how it was actually used in helping somebody. We're about to find out. Ava Illingworth is a student who this kind of kit, or I believe it is, this kit helped. Ava, what happened to you?
I was at a dance show at a school that I don't go to, and at the end of the dance show I ate a pastry from a local shop, but it had no... I'm allergic to peanuts, and it had no traces of peanuts, or it didn't have any nuts in it. So I thought it was okay to eat. But within seconds, my throat started closing, my tongue started swelling, and I went into anaphylaxis. But I couldn't find my EpiPen. I had no idea where it was. I didn't know if I'd brought it with me. But I had it with me. It was in my blazer that I was wearing at the time. But I was in such a state of panic and anxiety that I could not find it.
I was going to say, it must be really, really scary. People say, oh, you should have your pen with you, this, that and the other. But in the moment, you're just sitting there 1 minute, you're eating. And it must be when you realise that what you thought was safe wasn't safe, in that moment, it must be so scary.
Yeah, it really was. It was, I don't even know how to describe it. It's so scary. It's awful.
Yeah. So what happened? How was one of these kits at this school, or what happened?
Yeah, so I do my drama rehearsals at the school that we were performing at. And a couple of weeks ago, I had seen the kit that had recently been placed on the wall. And it wasn't there before, so it was a new thing that I had seen. And I could not find my EpiPen, so I got my dance teacher to go get the EpiPen from the wall.
You said so you managed to at least tell her to go and get that EpiPen, and obviously it was. Did you have to go to hospital after it was used, or do you? I don't know how these things work. Do you once you've had the EpiPen, is everything 100%? Is it fine again?
It depends on the person. So an EpiPen can take you out of anaphylaxis, but sometimes you need 2 doses. Sometimes one isn't enough. But once you've used an EpiPen, you have to call an ambulance, and the hospital will usually keep you there for 6 hours for observations.
And that's why Zach's kit is so good, because he's got those extra doses should you actually need them. So I mean, this, and I know you both of you were on Vanessa Feltz's show when you actually got to see the person behind it, because I'm sure until you saw it and you noted it, never in your wildest dreams did you think that it would be, well, a lifesaver.
Yeah, and never thought I'd have to use it.
Yeah, absolutely. Thank you so much. Just finishing off with Professor Adam Fox. Adam, this is an absolute demonstration. One, I mean, Zach's ingenuity is well, a lifesaver. It's not overly dramatic saying that, but it does show the importance of everybody having an awareness that this is an issue, ensuring that there is a kit there, and possibly even, if not training people about it, alerting people to it.
Absolutely. I think one of the biggest gaps really in terms of the care that we're able to offer people with food allergies is just public awareness. And I think it's very reasonable that people should be able to send their kids to schools and know that their children are safe. And what that means if your child has food allergy is knowing that there's somebody who's going to be able to recognize when there's been a reaction, who knows how to deal with that promptly. Because the reason that we prescribe adrenaline injectors to patients, the reason we ask them to carry around with them, the reason that it's great that they're available in schools is that they really work best the earlier that they're given in an allergic reaction. And it's the prompt use of adrenaline as soon as you've recognized it's a severe reaction that can make a very real difference.
Yeah, thank you so much, because I guess we've come to understand and accept defibrillators as kind of always being there. We need just as much of an awareness on these types of kits. And coming back to Zach, I mean, it is amazing, isn't it? I love stories like that where people use their own pretty scary experience to change the experience of everybody else. I just think it's a fantastic story.
Yeah, thank you. I obviously created these, you sort of make it and then you think, oh, but it will never be used. It's that sort of nth degree scenario that you're putting it out there. It's, we want to be proactive rather than reactive. And the day that we had the incident report filed on our software that it had been used in this school, I found out and I burst into tears. Honestly, it completely threw me off because I didn't realize how much. I wasn't expecting that scenario to occur so quickly. We only launched in February. We're in 160 schools across the UK now, and that number's growing constantly. But for the incidents to happen, and they will happen, we can just be confident that hopefully we can be there if they do, and we can avert the crisis.
Zach, thank you so much. Just before I let you go, if there are anybody in a school, or maybe it's a youth club or somewhere where there's young people, and they're interested in those kits, how do they go about getting one?
They can make an inquiry on our website, which is just www.kittmedical.com, Kitt with 2 T's, and we will, deal with that inquiry, speak to the school, and then if it's right, then the school can purchase however many kits they need. Normally, we base it on how many defibrillators they've got, how many students, the size of the campus, and from there, we obviously provide the training package, the subscription service of the pen, so we replace them before they go out of date as well, and it's just this all-in-one convenient service that schools are really finding useful.
Yeah, brilliant. And I'm sure a lot of universities will reach out to you as well. Zach, thank you so much. Zach Marks there, Kitt Medical co-founder there. And we